Again, I'll turn it over to Dr. Haushalter, who's going to talk to you about some of the changes coming in our health directive.
Thank you, Chief McGowan. Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. This afternoon, we're going to change our process just a little bit. So I'm going to give an update on data as I generally do, talk a little bit about the changes you can expect in Health Directive number 13. Then we will open it up to question and answers. And then around 12:30, I ask everyone to stay on. I'm going to turn it over to Mayor Harris, and some of our guests who are here with us today are going to highlight some of the museums in Shelby County and how they've been able to open safely. We really want to encourage people to get back to using our amenities locally, so please stay past the 12:30 time to be able to hear that information. As of this morning, we had 32,306 cases. That's an increase of 258 reported in a 24-hour period. I want to note that that's reflective of many days of testing. So even though we saw that increase yesterday, that's a reflection of a test not being reported as opposed to an increase in cases. We are still trending downward and doing that very slowly and incrementally, but as Chief McGowan pointed out, that's a testament to all of the work that's happened in Shelby County. Unfortunately, we have 490 deaths, but that's still representative about 1.5% of our overall cases, so that's still positive for us. For those who have recovered or viewed as inactive cases, that's 94% of our cases are well over 30,000. So the majority of people recover and do quite well. We currently have about 1,400 active cases that are still in that process of recovering. What's most important is that our contact investigations are going well, and to date we have been able to close approximately 86% of those contact investigations, and to date we've identified over 28,000 contacts. Today we have over 6,000, almost 7,000 people who are in quarantine. I want to pause for a minute and talk about those things that are critical as we move forward, and then talk about the health directive. We have referenced previously that there are key areas that we need to continue to focus on. One is communication, and particularly getting messages, the right message to the right people at the right time. So focusing clearly on the community more broadly, but also businesses and others, so that they have information to make sound decisions. The other is case investigations and contact tracing. Many employers are helping out by assuring that they keep a safe and healthy workplace, not just to prevent the transmission of COVID, but also to help identify cases and exclude them from the workplace. It is critically important that employers notify the health department when they have a positive case amongst their employees. That allows us to partner with them to be able to isolate and quarantine people in a very timely manner. The third area is enforcement. As we've said before, we'll be laser focused on enforcing the health directive, but specifically focusing on those businesses that are non-compliant. Preview one of the changes in the health directive. One of those is that if a business is closed, it may take up to 2 weeks for us to be able to work with them to implement a plan to reopen. So it's quite different than what we've been doing previously. So we want to make sure that people are aware that enforcement component will be both surveillance. We'll just go out and randomly look at businesses. We also will respond to complaints that come in. And our restaurant inspectors, as part of their routine inspections, are also looking at compliance, particularly to masking and social distancing, which we know are critical. The last is testing. And as Chief McGowan mentioned, we have significant testing capacity in our community. It is being underutilized, so we encourage people to get tested. And as was noted, at 2 of those sites, an appointment is no longer needed. Additionally, because of Hispanic Heritage Month, we noted in September that both September and October, we would have specific events that are targeting or at least trying to improve access to testing in the Hispanic community. So on Saturday, October 10th from 10 to 1, there will be testing at the St. Joseph Catholic Church on Neely Road. And for more information, you can go to Shelby TN Health. So last, I want to talk about Health Directive number 13 and what you can expect when it is posted. There are actually minor changes, but for some of you, there are ones that you've been anticipating. We will allow restaurants, including limited service restaurants, to remain open till 12 o'clock. However, I want to point out that even though they're allowed to be open, there's an expectation of compliance and adherence to all of the health directive measures, including social distancing, masking, and so on. For a table, previously we limited the number of people who could be seated at one table to 6. We're going to increase that number to 8. And then everyone has given feedback, or a large number of people have given feedback on the distancing that we've allowed at sporting events. So if you recall, for indoor events, initially we were at 18 feet. We decreased that to 12 feet. We haven't seen any increases in transmission as a result of that. So for sporting venues, we will reduce the social distancing to 6 feet from one group to another group. And that will have a significant impact on many of our venues locally. I also want to reinforce what I said earlier for enforcement. We really strive to educate business owners, stay engaged with them, and provide technical assistance. But for those who elect to be non-compliant to the health directive, we will close those facilities and they will remain closed for approximately a 2-week period, or until such time that they have a plan approved by the health department.